My name is Rainier Aquino. I'm a vascular surgeon at Jersey Coast Vascular Institute at Ocean Medical Center. When you have a weakening in the blood vessel wall, the aorta, it can expand or bulge, and this is what is known as an aneurysm. The aortic diameter typically is about 1 inch or 2 centimeters. And when it expands well beyond this safety margin, it becomes an extreme health risk because these can burst. When it does burst, patients can experience severe internal bleeding that can lead to shock or even death. Most patients won't have symptoms when they have an aneurysms, and if they do, they can experience one or more of the following. They can experience abdominal or back pain, and this is a concern because we want to make sure it's not leaking or bursting. Some patients may feel an unusual sensation in their abdomen, such as a pulsating mass or a heartbeat in their abdomen or a second heartbeat. As far as treatment's concerned, there are essentially 3. There is a watchful waiting, there is the traditional open surgery, and then there's a newer method, the endovascular approach to treating these aneurysms. The traditional method involves open surgical repair, and generally that will be recommended when the size of the aneurysm is more than 5.5 centimeters. And this essentially means replacing that diseased aneurysmal segment with a man-made, durable, tube-like graft. The typical length of stay for the traditional approach is about 3 days to 7 days. However, 90% of these aneurysms are successfully treated in the long term with this approach. With the newer endovascular approach, instead of having a large incision in the abdomen, there are 2 smaller incisions in the groin. And instead of replacing it by hand with a tube-like structure from the outside, we'd fix the aneurysm itself from the inside by placing a stent graft within the blood vessel itself, which with the goal of completely excluding the aneurysm from circulation. With the endovascular approach, the length of stay generally is about 1 to 2 days, as opposed to the traditional approach, which is longer. The important thing about the endovascular approach, however, is that it requires more frequent follow-up with your vascular surgeon. In addition, more frequent imaging studies to assure that the stent graft is functioning properly. In general, about 200,000 Americans are diagnosed with aneurysms every year, and of these, about 15,000 are life-threatening in that it can lead to bursting or rupturing. The key is, follow-up to assess the growth, and ultimately they're going to require repair of their aortic aneurysm.